The Honourable Leader of the New Democratic Party.
Last month, a private for-profit healthcare clinic opened up in the city on Joseph Howe Drive. It calls itself the Unified Health Community Triage Centre, and its basic business model appears to be based on customers being able to have a 15-minute appointment with a nurse practitioner in exchange for paying a $35 fee. So I want to ask the Premier clearly, in his opinion, is it right that a person in our province should have to pay $35 for a medical appointment?
The Honourable Premier.
Mr. Speaker, you know, Mr. Speaker, that the healthcare system is publicly funded in this province. And Mr. Speaker, we expect all of the institutions that are providing healthcare services to meet the Canada Health Act.
The Honourable Leader of the New Democratic Party.
This for-profit clinic is deeply troubling to many people who are concerned about public health care. And one of the things that's most troubling about it is that this private for-profit clinic has listed amongst its investors, partners, sponsors, the province of Nova Scotia and the province's InnovaCare. Here we are with a public health care system strapped at so many levels for financing. So I want to ask the Premier, what in the world is the government doing using public resources to fund a private money-making health care project?
The Honourable Premier.
Mr. Speaker, I'm not sure the organization he's referring to. If he's referring to InnovaCare, it's an arm's length organization from the government, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Well, this may not be an abiding concern for the Premier, Mr. Speaker, but it was an abiding concern this weekend for Doctors Nova Scotia, who met to discuss this issue. Kevin Chapman of DNS said after the meeting, and I will table his words, that the private clinic seems to create a two-tiered system at a time when our focus should be on strengthening the public system rather than trying to concurrently put a private system in place. A person could fairly conclude that the emergence of a private for-profit clinic providing a service that is supposed to be provided in Nova Scotia free indicates that the job the government is doing on providing health care is missing the mark at a pretty basic level. What other conclusion does the Premier think the public in Nova Scotia ought to come to?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. What the people of Nova Scotia should conclude, Mr. Speaker, is that we received 160 family doctors. We know there's more work to do. They should all recognize in September there's 19,000 Nova Scotians who found themselves attached to a family practice in this province, Mr. Speaker. They should also come to the conclusion that we've opened up 10 residency seats to ensure that we're training more young doctors in this province to be able to continue to work in this province. Also recognize and come to the conclusion that those 15 specialty residency seats were put in place to ensure that we deal with the issue and making sure that we have specialists in our province. And we're going to continue to make sure that we reach out and provide primary health care services to all Nova Scotians.